Welcome everyone to the Workforce Development Series presented by the Charlotte Regional Business Alliance and the Charlotte Executive Leadership Council. And we are delighted to have you with us today. My name is Gene Woods, and I am President and CEO of Atrium Health, the largest, most comprehensive health system in North Carolina. And I'm also Vice Chair of the Charlotte Executive Leadership Council and Co-Chair of its Workforce Development Working Team. Atrium Health, the CELC, and Charlotte Alliance believe deeply in the vital importance of growing a strong and diverse workforce to ensure the success of all of our businesses in the greater Charlotte region. Because we know that hiring and developing people with diverse backgrounds and perspectives can lead to better decision-making, to greater innovation, and higher engagement in the workplace. In fact, according to a recent McKinsey report, an analysis of 366 public companies found that those in the top quartile for ethnic and racial diversity were 35% more likely to have financial returns above their industry means. So it turns out that diversifying our workforce and leadership teams is not only the right thing to do, but it's also good for business as well. That is why here at Atrium, our Career Development Center focuses on developing new competencies and skill sets that will lead to higher paying jobs for our own teammates and those in our community, including through programs such as Rise to Success, Education That Works, the Mayor's Youth Employment Program, Health Career Pathways, and Road to Hire. More specifically, we are working in partnership with businesses, local government, and community leaders to establish strong economic mobility pipelines so that we can give everyone a real chance at a better life through specific job skills, training, and professional development opportunities, which can turn into rewarding careers that have generational impact. But we can't do this alone. That is why we need each of you here to play a pivotal role in this impactful work. And our goal is to form a broad-based coalition of people committed to ensuring equitable economic opportunities for all in our community. So as you participate in the series today, we hope that you get inspired and embrace this opportunity to enhance the innovation, creativity, and success of your own organizations through programs that prepare diverse talent to fill your workforce needs. Working together, I strongly believe that we will make the greater Charlotte region a model for economic mobility for the rest of the nation, which ultimately will build healthier communities and enhance the vitality of all those who reside in our amazing city. Thank you for joining us today.
All right. Welcome, everyone. So Gene actually said so eloquently what I want to share with you all this morning in my welcome. So first of all, thank you so much for taking your time on this first day of September on a rainy morning to join us for this Workforce Development Series. Today, and in the coming weeks, as Gene had mentioned, we look forward to bringing you virtual sessions to learn about workforce development programs to develop our local talent and put them in good paying jobs. My name is Catherine Black and I'm with Bank of America. And you may wonder, why is a banker facilitating a workforce development conversation between two major healthcare organizations? Well, as Gene mentioned, the Charlotte Executive Leadership Council, over the last 3+ years, I had the great privilege of supporting my CEO, Brian Moynihan of Bank of America, and chairing the Charlotte Executive Leadership Council. That is a group of approximately 30 major employer CEOs, a handful of small business CEOs, and 3 major education institution presidents. And their sole focus is to come together and from a public-private partnership perspective, really build the economic mobility engine within Charlotte. The Charlotte Regional Business Alliance, in partnership with the CELC, Charlotte Executive Leadership Council, has developed this series to educate, engage, and empower hiring managers about workforce development opportunities with the overall goal of achieving 1,500 program graduates in 2021, not just program graduates, but graduates who have jobs. We want to thank you for participating in today's session, where we will highlight our two major healthcare organizations, Atrium Health and Novant Health. And I am so thrilled that I get to facilitate this conversation with two gentlemen with whom I've worked over the last 3 years on workforce development opportunities. I do encourage you to ask questions. You may put them into the chat to Ashley Hedrick. And before we get started, I just thought I would frame just a few key stats, just a little bit of the why behind today. Our regional labor force is about 1.6 million people. 55% do not have a post-high school degree. We know from national labor statistics that the unemployment rate for people who have a post-high school degree is half that of the unemployment rate of those who do not have a degree. But there is so much untapped opportunity for those non-degree holders, and that is why we are here. For example, in the healthcare industry, there are about 650 CNAs or certified nurse assistant vacancies in the greater Charlotte market. CNAs are a great entry point role into other healthcare roles, particularly a registered nurse role. And right now, there are about 550 vacancies in Charlotte for registered nurses. There are also new roles being created in the healthcare sector here in Charlotte. One that you'll hear a little more around called the community health worker. So there are a tremendous amount of opportunities. The collaboration between our largest healthcare organizations is truly a model for us all to study. So let me introduce to you our two panelists today. The first is Gerard Camacho of Atrium Health. He's the AVP of Learning and Career Development. He's responsible for the creation and implementation of the workforce development strategy for the system, impacting more than 60,000 teammates and leaders. And we also have with us Rocky McGregor of Novant Health, who works directly with Novant Health's Executive Vice President and Chief Transformation and Digital Officer to explore and deliver new business opportunities that are enabled through the transformation and digital officer channels. So I'm going to tee up a question first that I'll hand over to Rocky. And that question is around the demonstration of the collaboration and partnership between Novant and Atrium that I have witnessed over the last few years. And I will tell you all, both of our panelists today are so great at thinking of the bigger picture of our community. These two healthcare organizations are competitors, but they're the perfect model of how you come together for the good of the overall community, and it's good for the community, and it's good for these two huge organizations because we are talking about the demand for talent. We need to fill the demand, and as I talked about earlier, there are plenty of people to do that. We just have to match the supply and demand and make sure that those people are trained for these roles. So with that, Rocky, talk a little bit about the collaboration.
Thank you, Catherine. And I also want to thank the Charlotte Regional Partnership for this opportunity, and certainly the Charlotte Executive Leadership Council for affording all of us as partners to come together to serve our communities. You teed it up well. When we talk about Atrium and Novant Health, many view us as the competitors that we are, and we are fierce competitors. When it comes to looking at our communities and understanding what's going on in our region, Charlotte specifically, we understand that there is a need for us to collaborate and come together and focus on the communities that we all serve. And so in 2016, which is very interesting, in 2016, Gene Woods, Jesse Curitan, Carl Armato as the CEO of Novant Health, they came together and said, hey, we saw what was going on with Keith Lamont Scott. How can we do something? How can we change that trajectory? And they came up with a model called One Charlotte that gave birth to the One Charlotte Health Alliance, with the focus of One Charlotte Health Alliance being on improving health and well-being in every community. And in doing that, I was afforded the opportunity to partner with Brandy Newman and Gerard Camacho, really focused on from a workforce development standpoint. From a workforce development standpoint, we understand that the social determinants of health, workforce being one of those, how can we assist our communities first and foremost with a livable wage? How can we assist them with providing a career path that we within healthcare find to be fascinating, interesting, compassionate, empathetic, and one that focuses on the overall well-being of the people within our community? And so out of that One Charlotte Health Alliance, the partnership, along, I might add, with Mecklenburg County was born. And since that connection and partnership, we focused on the certified nursing assistant, because as we spoke to our community and we listened to our internal community, both within Atrium as well as Novant Health, we learned that there were many certified nursing assistants that were within the communities that we were looking to impact. So why not start with our own team members first? And in doing so, we focused on understanding what are the barriers associated with moving from a CNA to to a registered nurse. What are the barriers associated with that? And in more general terms, what are the barriers for you moving from a CNA to any other opportunity within healthcare? And certainly we learned that the financial burden was on that list, but we learned so much more. We learned that many CNAs have become CNAs and not pursued their education because of their commitment to their families, the dependent care that they were offering, to their families. We learned that, there were challenges associated with transportation. We learned that from a wage standpoint, if you're going to school, you have to study outside of the classroom. And where are you going to take that time from? If you're caring for a family, if you're working, where are you going to find that time? So what we learned was it was more than just tuition and books. What we learned was that we had to assist them from a life journey perspective. And so, both of the healthcare systems collaborated together to really compare notes, understand what we've learned in our listening tours, and that gave birth to an opportunity for us to not just place our team members on a path on a career path that would lead them from an upward mobility standpoint, to higher wages. But it was also about, again, the social determinants of health and the well-being. When you are, no one is looking for someone to provide them with a handout. What they're looking for is for somebody to recognize that they have a gift and a talent to offer and to invest in them with that gift and talent. So very proud to say that through that partnership, we have afforded many team members the opportunity to go on and pursue their careers. We're going to hear from a couple of those from Atrium and Novant a bit later in our segment today. And I think that it will encourage and motivate and give tangibility to the action that's following the words that our two healthcare systems and our leaders made a commitment to back in 2016. Just a little interesting note I'll share is back in the early 2000s, there was actually an organization called CASH, which really was the original partnership between the two healthcare systems. And CASH was the acronym that stood for Carolina's Association of Community Health Equity. And Dr. Jerome Williams, who leads our community engagement space, was one of the partners and the originators of pulling us to healthcare systems together. So I just wanted to say, although there's fierce competition, there's been a long history and track record of us partnering to do right by our communities.
That's awesome, Rocky. And again, just to the group, we do have employers on the line. And if you are not in the healthcare sector, this is just a good use case for identifying common roles within a sector that you have demand for, and how do you come together with like employers to really create some pathways. So I think that is such a great example, Rocky. So with that, let me switch to Gerard, and let's talk about preparing our workforce for the future. Daunting task. We've seen through the pandemic how important our healthcare workers are, and it's around recruiting, training, giving them mobility, retention, development, all of that. So Gerard, I'll turn it over to you just to talk about what that looks like in the industry and some of the things you're working on.
Absolutely. Thank you, Catherine. And thank you, everyone, for joining us this morning. It's an absolute pleasure to be here. Really, really great partner with Rocky McGregor and their organization. So one of the things that we've been doing since the partnership is that we continue to evolve and we continue to grow from and learn from one another, right? I think Rocky was putting it very well together. The first point of contact in this new environment of workforce development was, let's figure out what's a common role. Let's operationalize the strategy for how we're going to create pathways to better careers and economic mobility within our system, starting with one position, right? And how do we make that impact? How does that impact the community? How do we bring individuals and talent into those job roles? And then how do we develop them internally up, right? To create those pathways to family sustaining livable wages and address those social determinants of health. But at the end of it, then really the evolution of our work has really come down to the learning of what are the needs of our community, what are the needs of our system, and how can we marry the two? How can we build that bridge in terms of our demand for labor and the supply that is out there that may be ready or not ready yet to enter the labor force in the healthcare system? And one of those key starting points was doing analytics and data in terms of understanding what are going to be the needs of the system in the next 6 months, 1 year, 2 years, 3 years, 5 years down the road. How does new market expansions, like Rocky said, we're fierce competitors and we're competing for market expansion and for new facilities in new regions. How does an opening of a Claremont facility or an opening of a Novant facility affect our retention rates? Or how do we do that, attraction for new talent? And what does that look like for how many vacancies are we going to have due to that? And how many people in the community are ready for those job roles? And if there's not enough, how can we create those talent pipelines into the system, right? And I think that's whenever organizations like us, that may not be necessarily in healthcare, there's an opportunity for you to look at what is going to be the talent demands for the future, and how do you repurpose your current talent pipeline roles, including all the recruiting activities, all the, for us it's clinical placement and academic affiliation agreements, right? Or our partnership with CMS or our partnership with CPCC. How do you leverage existing activities that you can repurpose to create specific targeted outcomes, right? Specific targeted positions or pathways to positions that are going to be coming into the system. And how do you create those income mobility opportunities through that process? So I think that for us, It really was in terms of like the data and the analytics, looking at the future, seeing where we had the biggest gaps, seeing where we had the biggest retention issues, seeing where we can go into the community and create, those talent mobility opportunities for individuals, and how we partner with Goodwill and with the other organizations to create those pathways and prepare people into those skills and competencies. And then from there, how do we expand to other activities? How do we really start looking at the benefit to the organization? Like Gene was talking about in the video, it's really great that we work with our communities, but at the end of it, it's really for the benefit of the organization, because we have better retention rates, we have better productivity rates, we have better outcomes. So for us, it was about looking at the whole strategy of how do we bring people into the organization to satisfy those needs of the system, but also how do we take this wonderful opportunity to create those bridges from the community and to really go into that untapped potential or that untapped talent that's within our communities, and how do we partner with all these wonderful nonprofit and non-government organizations and government organizations across the region to create those talent pipelines in, right? Because alone we cannot do this. It's something that Rocky was talking about. It's not only about the education, it's not only about the tuition, it's not only about the opportunity. It's about addressing individuals as a whole to make sure that we are really taking care of all those needs that are important for their success, right? Taking care of their family members, transportation issues, whether there's going to be family violence intervention outcomes, or there's going to be, food deserts and food security, things like that. So that's whenever, and I forgot what the original question was, and I just went into this passionate discussion about this. But really, that's for us, that's what it was in terms of like understanding what the data needs were for the system, and then how do we create these opportunities, and how do we work within our community to now do multiple roles. We started with one, but now there's all these different pathways and avenues for the system.
That's awesome, Gerard. And, when you talk about analytics, I think, that is something across the entire ecosystem that we continue just to all be hungry for, our demand analytics from employers within an industry sector. What does the labor force look like? And just, and I know we continue to focus on that so that we can understand what the opportunity is. So analytics definitely rings true. So I'll transition now for a second to Rocky and back to you, Gerard, just on some of the specific programs and initiatives within your organizations. Maybe some use case of folks who have gone through the programs, because there's nothing better than a testimonial of someone who says, here's what my life was like before, what I was earning, and here's where I am now, and here's what I'm dreaming. Rick Elias, who is the founder, of course, he's a founder of Red Ventures, but also of Road to Hire, has this quote that says, hope has an expiration date. And that has really stuck with me. And so, the idea of a meaningful career path is hope. It's hope for individuals and families, and thus neighborhoods and communities. So, Rocky, I'm going to turn it over to you to talk a little bit about some of the things that Novant is doing specifically.
Thank you so much again, Catherine. And Gerard, that was spot on. There are a number of things that we mentioned associated with the certified nursing assistant. In addition to that, it's also good to take a step back from healthcare and look at what we're doing outside of the clinical space. One of the areas that I would just mention is one associated with our digital products and services area, which is our digital technology space. And we bring in some 50 plus, interns at any given time. And these students are afforded the opportunity to stay at Novant Health until they graduate or decide to transition or actually transition into a role that we have at Novant Health. So going back to Novant Health and on the clinical side, there are 4,000 plus student rotations that we run through. And to your point about Road to Hire, we bring in a number of partners like Road to Hire because both healthcare systems are not looking to replicate what's working. I think I need to say that again. Both healthcare systems are not looking to replicate what's working. We're looking to collaborate, partner with what's working, and ensure that we keep a focus on what the community needs are. The last thing I'll just mention real quickly is the community health worker role that you talked about earlier. Critical role. Why is it so critical? Because those that are community health workers, the ideal community health worker actually comes from the communities that we're looking to serve, right? So coming from the community and being afforded the opportunity to be educated by our healthcare systems afford us the opportunity to take what we believe is a trusted partner within the community, provide them with the necessary resources, and then be able to have a trusted conversation. Those community health workers are the compensation associated with that, strong, livable wage, provides another career path for members of our community to actually have, direction as far as other opportunities to serve. So I know we both have a couple of examples that we wanted to share. And I think Gerard, I think there was a video that he had teed up that he wanted to share.
Ashley, are you running it or is Gerard running it? Okay.
Rise to Success is one of Atrium Health's signature workforce development programs. The program is a youth initiative targeting graduating seniors from area high schools and provides a career pathway for outstanding graduates with a 3.0 or higher GPA who are interested in healthcare educations and careers. Rise to Success enables participants to earn a certified Nurse A certificate and an associate's degree in a healthcare-related discipline from a community college with Atrium Health support. Participants will have an opportunity to obtain a part-time position at Atrium Health and are encouraged to pursue their bachelor's degree upon program completion.
An important thing students should know when applying for the program is that if you put 101% effort, then you can always do it. And the reason why it's the best opportunity is because they support you with school as well as a job.
What I enjoyed most about this nurse aid course is building a close bond and relationship with my classmates. And I really don't have the need to call them classmates. They're more close friends, and I feel like I can depend on them for anything.
I learned that I am great with patients. I'm confident in myself, and I just like helping people.
You're making long-term friends and you're connecting with a lot of people in different medical fields. They're like a family. It's just not about work. They want you to come and love what you're doing and come to work ready to work and not having a bad attitude. This is just a good program for low-income people who don't have the financial aid or have the money to cover college and let you major for what you want to major for. So it's just really an opportunity that you can't pass up.
Rise to Success is one of many ways Atrium Health seeks to make a difference in economic and social mobility issues in the Charlotte community. As the largest employer in Charlotte, Atrium Health has a responsibility to prepare the next generation of healthcare workers.
Awesome. I'm going to turn it over to you, Gerard, to talk now a little bit more about how that program is going and other big initiatives that Atrium Health has around your workforce development.
Absolutely. So seeing that video makes me feel like a proud papa. I mean, that's awesome. Whenever you're talking about the vision for the future, that's it. It's right there. The future is pathway opportunities for individuals that, may not have the experience, the know-how, the connections, the exposure to healthcare careers that can go into nursing careers, or it can go into allied health careers, or even medical school careers that we're planning for the future as we're planning that, innovation district and that medical school for the Charlotte region. It's precisely about that. tapping that potential that is within our community, providing opportunity with all these wraparound services and with scholarships and paying for tuition and do all those things so that we can meet the demands of our system in terms of talent. That's the future. The future is how do we create that pathway and how do we fill those positions through that process. And we have wonderful partners that we're working with, Novant being one of them. But like I said, the school districts and the colleges in the area are just another one. The ability for us to connect individuals with, the connectivity divide, right? Or laptops and hotspots and things like that are so needed right now. So what are the things that we're doing in terms of other roles and other programs and other opportunities is, again, we started with that CNA to RN scholarship program, and now we have an education that works. We have that Rise to Success. We're working on a pathway for individuals that are going to be, we have previous, have been previously incarcerated, so justice involved individuals. We're hiring the first cohort of 10. And we're partnering with Johns Hopkins and the mayor's office to do that and to bring individuals in. We hope to have 20 by the end of the year, and we hope to ban the box by the end of this year so that there's no criminal record questions asked during the interview process, but rather it's just a good fit for the organization, and we'll figure out where individuals can go and cannot go. But criminal background records are not going to be an issue for us anymore. We're trying to do that as we innovate in that process. We have embarked in the livable wage campaign, and we're at $15 an hour. We're trying to do that through all of our regions. Of course, the Georgia market has been a little bit more delicate for us because they were in a completely different space. But the social determinants of health work that both Novant and us are doing and what we're working with is really just trying to go ahead and make sure that we're impacting the long-term goal for us in the next 10 years is to impact the life expectancy of our communities via employment opportunities, via socioeconomic mobility, because we know that those social determinants of health, of access to healthcare, access to food resources, housing stability and security, all that, food security and all that, it's directly correlated to the ability to have a job that is, family sustaining livable wage, that provides you with healthcare benefits, that affords you the opportunity to have all those resources, and that's how we're doing that. So this long-term journey for the future for us and all these programs that we're working with are really little pieces of one big puzzle. That is, how do we bring members of our community through multiple pathways, whether it's going to be young adults that are graduating from high school and they go straight to work for us and they continue in this Rise to Success program, or individuals from our community through healthcare pathways and how they come into the system or the Justice Involved program, or even incumbent workers that are in lower positions through the Education That Works program. How do we create income mobility that works for everyone? Because we definitely have plenty of need at the family sustaining livable wage level in terms of all those job vacancies. The surge has taught us that we are not ready. And has taught us that we need more and more and more staff to continue to provide services to our community. And there's great opportunities for income mobility for all.
That's compelling, Gerard. Rocky, I'm going to ping back to you for some reaction and maybe a highlight of one of the employees that have graduated from the program. So I'm turning it over to you.
Yeah, thank you. Again, this is a workforce, event that we're having. So what we want everyone to take away is there are vacancies. We have vacancies. Those certified nurse and assistant positions, there are vacancies there. The community health worker positions that we mentioned, there are vacancies there. We have hired 9 community health workers and are planning to hire many more of those. So I'm sure that Catherine has a call to action for us at the end of this, but know that there are vacancies. I wanted to just tee up a success story from our CNA to RN program that we created. And I wanted you to hear directly from Brittany. So if we have that video teed up, Audrey.
It was going to be a really, rough semester for me if I didn't get any help. So then I was reading my email one day, and it said there was a scholarship for CNAs who currently work for Novant who are going to school at CPCC to become an RN. And I thought, hey, that's me. And when I read it, it seemed too good to be true, honestly. It said that you could work a limited schedule, that your pay wouldn't suffer, you get paid study time, you can still keep your benefits while you're working a limited schedule, which was a huge deal for me. So I applied and I got it, which it was amazing. They came, they brought a cake and announced it. I cried. I always cry. And it was something that I didn't really think about a lot before I got the scholarship and before I learned that Charlotte was dead last in economic mobility. But when you think about it, it's true. I started at school at CPCC doing my prereqs. I was working 2 jobs to support myself through the prereqs, and then when I started school at CPCC, I was still working full-time. And it was really hard, but I didn't have any other options. And those barriers that I was able to overcome, most people aren't able to overcome. Like, people have kids, they can afford to go part-time, they can afford to go PRN. So I think that's definitely a great thing that Novant's doing to help out with that. What I like about helping people get better is just the journey that they take, just seeing them move forward, even if it's just they're bedridden and then suddenly they can sit on the side of the bed, and then you see them from sitting on the side of the bed to standing up. That kind of thing is what I really like about seeing people get better, just the small steps it takes until they get there. It makes me feel great, especially when I'm a part of it. I feel like I really can make a difference and help be a part of these patients' lives. It feels tiring at times, but mostly it just feels good. It feels like I have a purpose.
Thank you so much, Audrey. And I'm also very proud and honored to actually have one of our students that has actually joined us today to kind of share her story with you as well. So we have on the Zoom here, Marcy Garcias, and she is going to share her story with you as well. Marcy, welcome to the call.
Hello, good morning. Sorry for my attire. I'm at work. I couldn't get today off, but I'm glad I was able to join.
Well, Marcy,
Yeah.
we'd just like for you to share just a little bit about your journey from a CNA standpoint.
Well, I was not a CNA. I was a medical assistant. And I became a medical assistant, but before that, and still I am an undocumented alien. So I put myself through school. I had to pay, out-of-state tuition, and there was no financial aid. I'm a recipient of the Dreamers Act for Deferred Action. So the DACA that was implemented by President Obama, that allowed me to go to school. And it allows me to work and pay my way through school. That's how I became a medical assistant. And I worked for a couple years with Novant as well. My first office was Uptown Primary Care in the One Wells Fargo building. And I knew I wanted to be a nurse. So I got my prerequisites. I worked 2 full-time jobs and went to school full-time. I don't know, now that I look back at it, I don't know how I had the time to do that. And I applied for CPCC and I got accepted. And I said, well, this is going to be hard, but it's going to take what it's going to take, but I'm going to get this done. And a couple of months before I started my first semester, I was awarded the Upward Mobility Scholarship. That came in like a big blessing. It saved me because I had no idea how I was going to work. I knew nursing was more demanding, nursing school, and I had no idea how I was going to work and go to school and study and learn the material, not just memorize it, because you can't do that with nursing. You have to learn it. But I was like, no, I'm going to do this. My parents helped me by, not charging me any bills. So I've been at home. I stay at home, and I don't pay any bills. And everything was just going towards my tuition. I was going to use all my savings for that. And luckily, the Upward Mobility Scholarship saved me, and it saved me a lot. It makes me emotional because I was able to focus on school and not be so stressed out. I was able to work and still maintain school life, be able to study and be able to dedicate that time to study and enjoying the journey, not looking at it as, oh, school again, or it's dragging, but it made it so much easier. And I'm very grateful for it. Right now I'm in my first rotation as a resident. I graduated in May. I'm in the cardiac track. And I plan to continue on and, further my nursing degree into a master's and continue on. To me, the Upward Mobility Scholarship, it's the biggest blessing that I could have received because I've always wanted to go to school, and not being born here, it's always been difficult to go to school and achieve those dreams. It was always hard. Before DACA, I thought I wasn't going to go to school. I wasn't going to be able to, get a job in like the medical field that I wanted. And although I was able to go to ECPI and, become a medical assistant, a phlebotomist, and an EKG tech, it was hard. I was tired, it was very exhausting. And luckily I got my foot in the door with Novant, and that scholarship is a big help. It makes you, it not only releases stress, but it makes you enjoy your journey of going to school and learning. It's not like a work that you have to do. You come to work and you're grateful for being able to come to work. And I only worked, I still continue to work full time because the scholarship gave me enough hours where if the part-time hours that let's say I would work, it considered me as a full-time employee. And that's my story.
Marcy, that's powerful. And I heard you say dream, enjoy the journey. So many of the talent pool that we've been talking about today, it's tough to dream, enjoy the journey. And so what these two healthcare organizations have done is to try to break down the barriers so that people can dream and enjoy the journey in this industry. Rocky, anything else that you want to sort of close with before we open it up for questions?
Well, and again, we just want to thank, the Charlotte Regional Alliance and the Charlotte Executive Leadership Council for the opportunity to share these stories. These are 3 stories of many stories that we're telling. And again, we want to continue to scale and grow and tell more and more stories. But more and more important than that is to make the impact in the community. Marcy has a story that she can now tell in her community to inspire others to follow in her footsteps. So really appreciate the opportunity to spotlight just a few of our students.
Awesome. Agree. There's nothing better than actually hearing from the people who are actually in the program. We can talk about it all day long, but Marcy, just having a face on it is just so inspiring. And we wish you all the best of luck as you continue on your dreams of getting your master's. So there are some, first of all, there's lots of woo woo for Marcy in the chat, how proud people are of you. And what an inspiration you are. I do have a first question that I'll send to Gerard and Rocky, which says, is apprenticeships part of your workforce program?
I'll start with that, and I'll say yes, they are. So we have a couple of apprenticeships that we've launched, and that's yet another way by which we're trying to provide pathways into these healthcare careers. We know that not everyone, you guys saw in that Rise to Success video, the minimum GPA is 3.0 as a requirement for our education networks. There's not such a thing because they're incumbent workers. But we know and understand that not everyone is a didactic learner, right? There's those motor skill, hands-on learning experiences that are also very valuable, invaluable, in fact. And there's a lot of opportunity there. So we've been working with we just did NC Apprenticeships and with Charlotte Works and with everyone that can get their hands on this. CPCC has been pivotal into this. So we do have a couple of apprenticeships that are live today, and there's more coming.
Thank you. Rocky.
Yes, Catherine, the answer to that is yes. And as I mentioned earlier, our goal in this is how do we, certainly from a clinical standpoint, provide visibility, insight, and opportunities, through the apprenticeship, but also, I think Gerard would agree that healthcare systems are like their own ecosystem, right? So we need financial expertise, we need digital expertise, we need real estate and construction. So all of these things are necessary, and we look to do that through partnerships. Right? We look to leverage what's working. So there's a program that we've been working with the CPCC associated with community health workers. They have a track that they've been developing, and how do we create this continuum, right, to where there's a closed loop of flow of insight and information, and we continue to scale and grow that. So yes, and we're looking for other opportunities. So continue to, for those in the community that are looking to explore with us, please share your thoughts and let us bring that into the room and synthesize and see where it makes sense and see how we can move forward.
Awesome. I am seeing some other questions. So there's one around how do you get leadership to buy into workforce development programs and identify the ROI? And I'm happy to start with answering that question because of the role I played with the Charlotte Executive Leadership Council. So one is, I will say there is healthy collaboration among a lot of business leaders regarding this topic, which is, this is not just about being altruistic. This is good for business. The demand is there. There is, I think, this myth among, many in the unemployed workforce that you have to have a 4-year degree in order to get some of these jobs. And we're trying to dispel that myth. Not necessary, but what is necessary after we certainly take care of all of the barriers to just taking the time to get trained is, it may be, a certificate. It could be a certain level of, training through, Central Piedmont or another workforce development partner. But the ROI is absolutely there. I think, Gerard, you mentioned, higher retention. As you can see, just from some of those examples, people are very loyal. When you invest in them, they're very loyal back to the company. We know that turnover is very expensive for companies. So if you invest in bringing that talent workforce in and you've overcome their barriers, they are more likely to stay with you. Let me open it up to Rocky or Gerard on that.
Well, I would just, kind of going back to the buy-in question that you asked. What I would say, Catherine, is this is in our ground at Novant Health. Our mission at Novant Health, we exist to improve the health of our communities, one person at a time. And so the buy-in was already there. It was connecting through listening to our team members and our community to understand where there is opportunity, the need within the healthcare systems to have this workforce opportunity and upward mobility is great. For those that aren't aware of what's going on even in nursing right now, looking at, for the first time, we learned a few weeks ago, Carl had a leadership summit where we all learned there are 5 generations for the first time in the workforce. That's great news, right? The other side to that is, we have, traditionalists and baby boomers that are retiring. So how do we bridge that nursing, gap that's lurking? So there's a tremendous need here, and to that end, candidly, our executive leadership were all in. It just took just articulating and a vision to move forward.
I agree, Rocky. I think that here in the Charlotte region, there's been a lot of focus on income mobility and opportunities because of the Chetty study and where we are. So there's a lot of buy-in from executive teams to do that. There's some other organizations and there's other sectors that may not be as fortunate as we are to have that, CEO level support and board, support to actually push for these initiatives, right? And this reminds me of the work that we did with the National Fund for Workforce Solutions, where we got together systems across the United States. So Norton in Kentucky, Advocate Aurora Health in Illinois, Massachusetts General, Parkland Hospital when I was in Texas, and then others in Grand Rapids, Michigan, in Boston, and all over the place. So we were having this discussion about how do you get buy-in from executive team and how do you determine that ROI? And that buy-in from executive team, for those that didn't have that support, it was critical to show the return on investment, right? Individuals, whenever you have executives that may not be that bought into the process, into the system, whenever you're talking about bottom line numbers, if you are able to quantify your data and say, hey, this is the bottom line, this is our turnover, this is our cost, this is our retention issues, this is our productivity issues. If you're able to focus on that and then look at other best practices that may be evidence-based design programs and practices, then you can say, hey, for example, whenever we instituted these type of learning activities for pipeline programs in Texas, then were replicated in Kentucky, and we were showing whenever you do pipeline developments like Catherine was talking about, the retention rate increases about 300%. And we were able to show that, for example, a patient care assistant or a CNA would be more likely to leave if they didn't have any support. And we were losing individuals at a rate of 66% every 3 years, which means that we were replacing two-thirds of our population in that employment group every 2 years. It had a lot of cost of productivity for the organization and also the recruiting. Whenever we had those programs that we launched as pilots, and now you can just look at individuals that have done these programs and then look at the evidence base. You don't even have to launch pilots. You can showcase this information as examples. The retention rate jumps about 300%, right? So you go into retention rates of the 90 percentile, right? You're retaining people at 95%, 93% retention rate. So that's how you get the conversation started about bottom line dollars productivity. And the return on investment, that's going to be the same. You just quantify and see how is it that the retention rates of individuals and productivity of those sectors, the ability to fill, job roles that are hard to fill, or the time that it takes to fill those job roles, that's your ROI. And that's how you start having those conversations within those organizations that may not be as lucky as we are to have that support from the executive team. Having those conversations, bringing the data in, now you can bring diversity and inclusion data points. You can start having those conversations and open the conversation that way.
And very quickly, I would just say, Catherine, that it's about the partnerships, right? Leveraging just what Gerard is saying, leveraging the partnerships. So there are many programs out there that we can connect with. The Mayor's Youth Employment Program has been around for 35 years, right? Linking into them, connecting to kids, connecting them to career opportunities. What our opportunity is to link it all together.
Completely agree. And I know we're down to 4 minutes, and I hope all of you are feeling energized and inspired by this conversation. If you are on this Zoom and you're not in the healthcare industry and you're kind of scratching your head, how do I sort of plug into all of this great momentum? One thing to also remind you, other than taking some of these best practices back, is also that there are some core roles that you can find across many industries, whether it's customer service, whether it's IT and tech. So I will say there are a number of entry-level roles that we have worked across sector to train for. If there's some roles like that in your organization, feel free to reach out. We're going to have a follow-up and a call to action here, but every single company has an opportunity to do, whether it's at a large scale or a small scale, exactly what Rocky and Gerard have described today. So yes, go ahead, Gerard.
And really quick, you just made me think of something very important. So right now, for all of our college partners out there, or people that work with, college students that you're in this call right now, we're hiring, as a result of the surge, we're hiring students into temp roles to assist. Because we don't have enough nurses to take care of this search for Delta variant, right? So we're hiring left and right. We're doing all these hiring activities. We send it to the deans of the schools. However, there's not enough. If you can help us pass the word, if you know of someone, the word of mouth, if you know someone, if you work with students, send them our way. We'll hire them on the spot. We have a hiring event this Friday and we need people. So make sure that you get that announcement to kiddos out there if you have any contact with them.
That is right. So we're talking about, I opened with some unemployment stats. We can eradicate that because the demand is there. And we have to dispel the myth that you have to be coming out of a four-year school to get any of the open jobs. That is not true. Four-year school is fantastic, but not all jobs require that. So that is a key point. So we ask, first of all, please share the word that the demand is out there in this industry. If you can complete the follow-up assessment of today, we want to get better. Visit the webpage for the links and resources, and there will be a follow-up on that. Continue to push the boundaries of what's possible for your talent pipeline. Identify roles that are in demand, and find the partners in the community that you can work with. And we mentioned a few of them. There are so many critical education and nonprofit and workforce development partners, many on this line that are important in this ecosystem. We can't do it on our own. And just remember that Charlotte started off with a pretty eye-opening study about the barriers to economic mobility in our community. I will tell you, my job in environment, social, and governance at Bank of America, I talk to communities across the country. And the first question I get when I tell them I live in Charlotte is, we hear great work is going on in Charlotte. Can you share what you're doing? So I want to give you all confidence that your participation, your engagement, your leadership is making a difference here, and people outside of this region are asking us how we're doing it. So thank you so much for your time today. We're glad that you joined us. Thank you to the Charlotte Regional Business Alliance for helping us put this program together. Thank you to my incredible partners in crime here, Rocky and Gerard. I so enjoy working with you all. You're an inspiration and want to continue to do that. And I hope you all have a great rest of your day. Thank you.
Thank you, Catherine.
Bye, everyone.